Welcome to Startup Health TV. This is a special COVID-19 health innovation update. I'm Logan Plaster, editor-in-chief at Startup Health, and I'm with Victor Penev, CEO and founder of Edamam. Victor, thanks for joining me for a chat this afternoon.
Yeah, it's always a pleasure.
So Victor, we've talked before about Edamam, about the massive food database that you've created that can be used as an API to fuel so many different things, so many different applications and platforms that need accurate food data. Start by giving me a quick look at where Edamam is today, and then we'll talk a little bit more about where we're at in terms of how that applies to the current pandemic situation that we're in.
Yeah, absolutely. So Edamam is a nutrition data company. We organize and structure food and nutrition data. Our mission is to organize the world's food knowledge so we can give it back to people to make meaningful, smart food choices and ultimately live healthier and longer lives. It's not a secret anymore that food is a medicine, that nutrition is key to prevention and to, essentially being healthy, not getting chronic diseases, not being sick. So our goal is to help people make those smart choices. Now, what we've built so far is a series of tools that we provide to businesses through an API, personalized meal recommendation, real-time nutrition analysis, food lookup, and so on and so forth. Those sit on top of what we think is probably the deepest and the broadest data set of food out there existing. We have over 5 million recipes, 750,000 foods, all tagged, analyzed, and tagged for every nutrient, every diet, every allergen, over 200 chronic conditions, and we're adding new things on and on, as we'll discuss in a moment. So that's where Edamame is, and we're very excited about the future. We think, if nothing else, this pandemic has proven how important food and nutrition is. And we also looking to expand internationally. So very excited about the future.
Just as a way of understanding the product more concretely, give me a case example of a partner or a client and how they use the database.
Absolutely. So there's a few different ways that companies use it, but a pretty straightforward way is Microsoft Bing. If you go and look for recipes on Bing, when you come up with recipes there, the nutrition data for those recipes comes from us. We do the same thing for Food Network, New York Times, Cooking, America's Test Kitchen, a lot of recipe sites. We do it for restaurants, for catering companies as well. The other use case is really personalized meal recommendations. One of our clients is Virta Health, for example, which is type 2 diabetic, but we work with other folks like Nestle, and very interested in interesting conversations with companies like CVS and Anthem and so on and so forth to essentially provide
such a broad spectrum of applications.
It is a broad spectrum of application. We serve food, health, and wellness companies, and we basically go where the market is right now. But personalized meal recommendation is the same tool that we offer to everyone. It is truly being able in real time to personalize, let's say type 2 diabetic, to provide for them foods that fit their particular profile. And it's not only that they're just type 2 diabetic, but that's what they have in the fridge. Maybe they just got salmon and they bought in the store. They don't like onions. Their significant other is on a paleo diet. Their kids allergic to peanuts. They don't want they want something that's low sodium. In real time, we can process all that, and we do that for companies. So that's another use case that we do.
Got it.
And one of the biggest, fastest growing sector for us right now is actually grocery retail, as people are shopping more at home, shopping more because they're cooking more. Recipes have become more important, especially healthy recipes. So that works there too.
So if I'm at home and I'm looking up a recipe, attached to that is going to be nutritional data that might be supplied by your API.
That will be one use case. The other is to be able to actually find recipes that fit your diet and nutrient and then shop for that recipe.
That kind of is an answer to what I was going to ask next, which is obviously we're having this conversation in June of 2020, in the middle of, we don't quite know where in the trajectory of the coronavirus we're at, but we are still in the middle of this. And I'm wondering how the pandemic has changed people's habits. You just mentioned the one about eating more at home. But are there other ways that people have thought differently about food as medicine during this time?
Yeah, I mean, It is everywhere. So a lot of people have started highlighting that you should eat in a certain way. Well, emphasize certain foods, de-emphasize certain foods, so that you can boost your immunity. And I think that the reason why we're talking today is that we've created that immunosupportive diet, essentially, that allows people, by selecting certain nutrients and foods and avoiding other foods, to come up with recipes and foods that they should eat to boost their immunity, which obviously helps people to prevent, to be more resilient to infection, and then if they do have infection, to better. And so that's the idea behind that immunosupportive diet we've developed. But to answer your question, yes, people are thinking a lot more. What should I eat? And you wouldn't be surprised that ginger and garlic are one of the more sought after items out there, because people are trying to figure out what they should eat. So healthy eating is becoming more prominent at the same time as people are cooking more at home. So healthy recipes become even more interesting for people.
How do you break through the noise with really data-driven, smart diet suggestions, like immunosupportive suggestions, in a market that's really kind of known for a lot of diet noise? I'm constantly getting bombarded on social media by eat this, not that, eat this, not that. And I start to tune it out because I assume a lot of it is quackery. And here you are.
Yeah. I mean, our plan is very simple. First of all, I do recognize there is noise. What we have built differently than everything else, specifically for the immunosupportive diet, is we're not recommending nutrients. We're not saying you should eat more turmeric, or you should emphasize omega-3 or what have you. We are basically saying those are actionable recipes, and because we're in a very unique position, because we have built that huge database of 5 million recipes that are already nutritionally tagged and analyzed. It is very easy for us to kind of link the science about nutrients to recipes and recommend recipes. So I think this is our unique proposition, that we actually provide actionable data. It's recipes you can cook at home. They're not super restrictive. If you want chicken or ham, you can do that. But we make sure that those recipes contain enough micronutrients in terms of herbs or other things. So that's one thing. The other thing is we are making this fully available to everyone for free.
Oh,
So
wow.
we're not charging for it. It's kind of our public service, do good. We build it with experts using scientific literature. We offer it for free to everyone, and we're going to start offering to our clients. Clients like Microsoft and Amazon and Nestle and Food Network and so on and so forth, which have a much bigger voice than we do. But ultimately, if they can integrate the immunosupportive diet into the recipes they offer and the meals they recommend, we would have fulfilled our goal, because then most people are going to have immediate access to such diet at the places they normally go. So,
Okay, so just to clarify, you've created a database of immunosupportive recipes, and you're making it available for free. Is that from your own app? Normally, you're sort of the back-end brain that feeds other companies. So is this something that you've created under your own name?
a little bit of both. So we're still providing it as a backend. It's not a database of recipes. To an extent it is, but it also is a set of rules that can analyze any recipe, say if it's appropriate for this diet or not. So for example, if we were to do a deal with Food Network or New York Times, we would analyze their recipes and say this portion of your recipes are immunosupportive, so they can kind of, and so on and so forth. So we can do that for any recipe out there for anyone, and anyone can use that. And this is offered through our API as a backend. And this is kind of what we want to offer to
it's
developers.
A filter. It's a filter you've created that's very scientifically validated filter.
Correct. And we expose that on our own website as a immunity filter that you can go and look at our recipe search. There is actually a landing page for the diet that we've developed, and there is a search bar there. But you can also search from the homepage. There is in the drop down in the filters, there is something called immunity. If you click on that, you'll be able to look for recipes within our database that are immunosupportive.
This would obviously be really huge for different disease communities. So people struggling with cancer, recovering from cancer, or obviously you mentioned diabetes before. Is that part of the plan, is to sort of make inroads into those different communities?
We
Or is
absolutely,
it more of umbrella, more big picture,
it's
like New York
absolutely
Times?
yes and no. I mean, I think everybody can profit from that in the way they eat. Obviously, people that are more at risk will be better served. But our goal is not to necessarily target particular populations. We really think this should be something that everybody can use. Because the reality of viral infections and the organism coping with that is, yes, you might be better served if you're a healthy young individual, but ultimately, that doesn't mean you can do things to boost your immunity and be a little bit more safe, so to speak.
Yeah. I know you're very forward looking. At some of our previous conversations, you cast a vision for 50 years from now. You're a bit of a futurist. When you describe the filter, it feels like a tech back end that could be applied in a lot of different ways. Are you already thinking about other filters?
Yeah, well, look, I mean, we've built a bunch of them. Any popular lifestyle diet we already have: keto,
Hmm.
paleo, vegan, low sodium, so on and so forth. Every allergen we already have.
Got it.
We built custom diets for clients that are targeting populations of type 2 diabetes or kidney disease or certain kinds of cancer and so on and so forth. We are constantly adding new data that will be useful to end users. We are likely to this year develop something around flavor and texture. We'll probably start genotyping recipes. So once you get your genome sequenced, we'll be able to
Wow.
kind of match recipes against your genome for foods you should be eating. We're working with a couple of companies that do blood sampling on biomarkers. Further down the road is microbiome data and so on and so forth. There are occasional new filters that we want to introduce. Like, for example, we just discussed with a scientist from the University of South Carolina about ingredient density, nutrient
Hmm.
density of the food. And so we might create kind of a filter around nutrient dense foods, be able to serve particular communities that are interested in that. So we're constantly expanding.
Fascinating. Are you going to create a filter to help me find recipes that my 6-year-old and 4-year-old will eat?
Uh, Absolutely. I mean, it does exist now. You just have to tell the engine what your 6-year-old eats, and
You,
hopefully it's not just spaghetti and.
well, when you mention texture, it's so interesting that to filter by texture. There's just some people who have an aversion to certain textures or are really drawn towards others.
Right,
That
right,
that
right.
made me think of kids and their funny proclivities.
Yeah, no, that will be one of the things. If things go to plan by the end of the year, we'll have something around flavor and texture as well.
Very nice. Um, what do you see as, when you look to 2021? A lot of our conversations on this channel are about kind of the post-COVID world. How do you see the nutrition world kind of leapfrogging because of this experience of the pandemic?
Well, nutrition, I think, is going to change just because the awareness of eating better it's grown so much. I think also habits will change, regardless of what, restaurants reopen and whatnot, people will end up cooking a little bit more at home just because they've become more familiar with their kitchens, turn on their ovens for the first time in years and so on and so forth. And also because it tends to be cheaper and a little bit safer. So I think, there is going to be a lot of changes in the food industry per se, in terms of supply chain, delivery, and whatnot. But organic foods, for example, are growing through the roof in terms of sales, and so all this, I think, is going to end up in behavior change, and people will be a lot more attuned to their nutrient needs and the way they eat. And so I don't know if I call it leapfrogging, but I would call it acceleration. It will
Mm,
be something that will bring the future faster to us than we envisioned at the beginning of the year in terms of how people eat for their health.
that's awesome. What's the next meal that you're looking forward to cooking?
Next meal I'm looking forward to cooking will be probably, I'm mostly vegan these days.
Yeah.
So, and I'm much more of a spur of the moment type of person, it's, if I see something, but it's likely something, I'm craving Indian dish, like,
Mm.
processed, so like a dal or something like that. So lots of spice.
Nice. Well, Victor, that's the time that we have. I really appreciate learning about what you're doing with this immunosupportive data and really seeing how Edamam is powering so many different ways that we access food information. So thanks for taking the time to
Yeah,
fill me in.
thank you. Always pleasure. Thank you
All
so
right.
much.
Take care, Victor. Stay healthy, and I'll see you soon.